Hello, my name is Dr. Celeste Reese. I'm a board-certified family medicine physician specializing in urgent care. Today, I'm here to share with you about HPV and its ties to cancer. What you do now affects your health tremendously later. So let's first tackle, what is HPV? HPV is human papillomavirus. There are about 3 million cases a year of human papillomavirus in the United States. What is it? It is a virus that is sexually transmitted. It is the most common sexually transmitted infection in the United States. Treatment can help this particular kind of infection, but it does not cure it. This is an infection that can last years or it can be lifelong. It spreads through unprotected oral, anal, or vaginal intercourse. Mothers that are pregnant can pass this on to their baby during pregnancy or during labor or in the process of nursing. So this is a virus that is very serious that can have implications throughout your life at later times. So how does human papillomavirus infection present? Sometimes people can have HPV and you may not know or notice any kind of symptom. It typically is characterized though by a genital wart. This is a cauliflower-like lump that may appear weeks, months, or even years after an infection with HPV. When someone notices that they have genital warts or there's a cauliflower-like growth in their genital area, you need to seek medical attention as soon as possible. This is an active infection that can easily spread to other individuals. And let's remember, HPV puts you at increased risk for other forms of cancer. We're going to talk about that in a minute. First, let's talk about how do we cure these genital warts when we have them. We typically will use electrosurgery to help remove these. Sometimes after removal, they can come back. So don't be alarmed if you have this diagnosis and someone says, hey, you have another growth that you have to come back and have it removed. Just make sure that you follow with the regular visits that they tell you that you need so that you can make sure that it's properly treated as much as possible. So let's talk about those 6 kinds of cancer that HPV puts you at increased risk for. It puts you at increased risk of anal cancer, cervical cancer, oropharyngeal cancer, penile cancer, vaginal cancer, as well as vulvar cancer. So 6 different kinds of cancers is a lot of different kinds of cancers, right? So is there something that we can do to help mitigate or decrease the risk? Is there something that we can do that can help mitigate or decrease the risk of developing this kind of cancer? I'm glad that you asked. The HPV vaccine helps to prevent 90% of cancers from HPV. I'm going to say that again. The HPV vaccine, which is given in a 3-dose series on the first day, then 4 weeks later, then at 6 months, that particular vaccine prevents 90% of the cancers from HPV that we just talked about, those 6 different forms of cancer. So by simply just getting this vaccine, you help to decrease your risk. If you're out there listening to this now and you did not receive the vaccine when you were 11 to 12 years old, that is when it's recommended by the CDC. We typically will give this vaccination series when an individual is 11 or 12 years old. However, it is something that is optional. If you have not been given this particular vaccine, especially if you're sexually active, I strongly urge you to consider taking the HPV vaccine so that you can take advantage of that 90% decreased risk of developing cancer. Okay, so you may ask, okay, well, how long does it take the cancer to develop? I'm glad you asked. It actually takes years sometimes to develop cancer. Nonetheless, remember what we said, what we do now has a tremendous effect on our health later on. So getting that vaccine now is super, super important. People that have HPV are at increased risk of cancer, but people who have immune deficiency issues as well are also at increased risk for developing cancer or having other diseases that could complicate this, and that would include HIV and AIDS. All right, so now that we have that straight, what are our points that we're going to take leaving this particular discussion? The things that are very important for you to know now is that anyone that has more than 5 sexual partners during their lifetime is at 13% increased risk of developing HPV. So make sure when you're choosing and deciding on whether or not you're going to be intimate with someone that you keep that in your mind as you're making that decision. And don't forget, If you see something, say something. Make sure that you're taking a look before you get involved in intimate situations. I can't impress upon you enough the importance of going out and making sure that you get yourself tested as well as your partner tested prior to engaging in sexual activity. This helps to decrease the risk of spread of sexually transmitted diseases. And if you haven't, take a look and a listen to our session on sexually transmitted infections. Thank you. Don't forget, we hope that this session has been very helpful for you, but we don't want you to forget that we have a 6th session called Ask Dr. Celeste, where you can ask any questions that you have about any of the information that we've presented. So don't forget to tune into our 6th session. Thank you.